What's up, beautiful people? Another day, another study about dementia. But I really wanted to talk about this study because there were some interesting findings, and I think it applies not only to preventing dementia, but it's just a principle in general. And this study was looking at physical activity in midlife and links to brain health and amyloid plaque burden. Amyloid plaque tends to build up in Alzheimer's disease, and you can see that buildup start before you have clinical symptoms. But unfortunately, the degree of symptoms don't always correlate to the amount of plaque. But anyway, previous research has estimated that nearly 13% of Alzheimer's dementia cases worldwide are linked to physical inactivity and sedentary behavior. This study followed people for about 3 to 5 years and looked at physical activity through questionnaires. They also did brain imaging, and they split them basically into 5 groups based upon the WHO physical activity guidelines. And that is 150 minutes of moderate intensity exercise a week or 75 minutes of vigorous intensity exercise a week. Those who basically did no exercise, those who did not adhere to the guidelines but did some exercise, those who did adhere, those who used to adhere but became non-adherent, and then those who became adherent. And the findings that were significant are increased physical activity from baseline to follow-up was associated with lower amyloid burden, which does suggest a dose response. Another interesting factor was those who were completely sedentary did have lower brain thickness in a specific area that's associated with Alzheimer's pathology. So it suggests that doing any level of activity is better than no activity, which is a principle that I've discussed with patients, and I've heard other people discuss that doing something is better than nothing. And a lot of people are paralyzed and wait till things are perfect or feel like they have to have the best exercise routine or need to devote an hour and a half to 2 hours a day to exercise. No, doing something is better than nothing. And another principle to discuss with this is, even though I don't think this is the most robust study or the best study, it does follow along with the whole body of evidence suggesting that physical activity is very important for dementia risk reduction.